National Children's Dental Health Month, and it's only right that we bring in our resident children's dentist and the mother-daughter dynamic duo I love so much, here to share with us a few tips about good oral health and practices for infants and more are Doctors Lynda and Krystle Dean-Duru. Welcome back, ladies. As always, it just feels like a family reunion every time you come. So, like I said, this month we are focusing all on oral care for our children and our infants as well. So what are you telling parents that are best practices that you can start at birth?
Oh, well, obviously prevention and proactive prevention is a core business practice for us. So that starts early enough from breastfeeding, make sure there's proper and painless breastfeeding, and also because that's good for your oral development and facial development as well. And so breastfeeding does not cause cavities, so it's important for parents to know that. However, you just need to wipe the mouth after feeding, and just like you don't want to leave any sugar residues in the mouth for infants, and things like spiffy wipes or just a clean washcloth will do the trick for them. And
and for toddlers and little kids,
we can already start brushing their teeth, and that's okay to use an anti-cavity or remineralizing type of toothpaste, and we're probably going to have some samples on the imaging there. But
so let's talk about some of those samples.
Yes, exactly. And those are hydroxyapatite toothpaste. It's not necessarily fluoride, but those are remineralizing toothpaste. So those are another option for parents if they're not wanting to use any fluoride. But the most important thing is using a small smear amount on the toothpaste, brushing twice a day.
Like a pea-size?
Even less than that.
Oh,
smear.
okay.
And not to rinse. Don't rinse. Use it as medicine.
And is this a tongue scraper?
So yes, a tongue scraper, very, very important because we keep bacteria on our tongue, so we want to make sure that we want the oral environment to be filled with good bacteria, good balance of good bacteria.
This is good for adults too,
exactly,
Dr. Krystle, so I hope that the adults are listening as well.
And don't forget flossing.
Flossing is so important.
Very important. Personally, I say as soon as a tooth comes in, start flossing the sides of it. However, if the teeth start touching, then you should do that. Although we want children to have spaces between their teeth. They don't have spaces between their teeth, start thinking there should be issues, but flossing very important for them.
Very important. So I want to ask it because I have a little one at home who's just started solids, and we're doing purees. But talk about the diet from infants up until children and how important it is to look at their diet and what they're eating and what they're putting on their teeth.
Very important because usually from 4 to 6 months of age, the brain is ready for what's called a chewing reflex. So having them chew is something that helps the muscles to grow their face. So very important to have them have whole foods. It also allows them to explore the textures and the taste for it, and that helps them to avoid being what we call the picky eaters as well. So chewing whole foods, like give them a whole apple, a whole drumstick, meat on bones, and cucumber, carrots, things like that. Just have them sitting up straight and their feet supported as well.
Very important. And Dr. Krystle, I know we've had an image with things to stay away from. What are some of the things we should keep away from our little ones?
All right, so that's really important. Things like food in packets, processed foods, obviously, a lot of the junk and the sugars, because it's not just about what's on the teeth, but it's how the body is utilizing the nutrients in the body, or be able to supply the teeth with what they need to be able to have strong enamel, to be able to have good bacteria in the mouth, like we were saying, and that's what's going to help avoid those cavities, also help to build strong teeth, build strong gum health, things like that. So the processed foods, things in packets that don't allow the chewing muscles to develop, and like we were saying, because that's what helps build the jaws nice and big as well.
So I need to give baby Grace a little chicken bone.
Yes.
Okay.
Oh yeah. Go ahead, have her, and it's good for the eyes and the brain and everything. And just so it's a full connected experience for feeding.
Well, she's watching now. She's like, all right, the doctor's already tell me what I'm eating for lunch today. So, ladies, I know you all talk a lot about sleeping patterns, and we're going to get more into that the next time you come back because there's so much to unpack. How can people follow you and get an appointment for their children?
Well, we're on social media. Definitely give us a call, but our website is www.kidsmile.com. and just follow us on social media, Ashburn Children's Dentistry, and ask us questions. We're always happy to answer them and speak to our patients and our team, everybody.
And you can ask questions right on our website. Ask the doctors directly there, and they will answer them on air. So, as always, thank you, ladies. Now I know what I have to make the baby for dinner.
That's right.
I appreciate it.
Yes.